So we've talked about the why. And I know that a lot of times when I talk to team members, they're like, I want to get to the phones. I want to get to the phones. Like, how do we handle this question? How do we handle that question? But a lot of the specifics of what we do starts with why. Why do we need to do those things? Now we're going to start talking about what. And really, the what about getting new patients and getting our patients back is really that hashtag patient experience. And we've already kind of talked about it before, but like our patients, their experience matters. Like the way they feel when they come in the office and the way they're treated matters. Now, I've talked to a lot of dentists about how can I be more efficient? How can we see more patients? How can we get more production? And in fact, I named my book Step Away from the Drill for dentists to get them to understand that it's not all about production. It's not all about trying to squeeze in as many patients in as possible. And I'm actually seeing right now, we've slowed our schedules down a lot because of everything going on. And people are actually doing better in their practices. We have more time with our patients. We're having more time for case acceptance. We're not trying to squeeze in so much production. And I want to talk about that because I've talked to a dentist recently who's like, Laura, how can I get more patients in? How can I get more patients in, shorter hygiene, assisted hygiene, all of that. And I'm all about efficiency. I'm all about trying to be as efficient and effective as possible, but not in lieu of patient care, not in lieu of our patients feeling like numbers, okay? So I asked the dentist, I said, okay, how's your relationship with your patients? And he said, amazing, excellent, right? And I know a lot of us focus on the new patient experience. How can we make our new patients, the experience amazing? But what about our everyday patients? What about the patients who've been with us for 5 or 10 years? What about the patients who are already current patients of ours? How is our relationship with them? And this dentist says, amazing, excellent. They love me. They love my practice. That's amazing. And I said, okay, so let me ask you a question. How often do you, dentist, how often do you see these patients? And he says, well, once every 2 years if they're healthy, or twice a year if they're healthy, okay? I said, okay, great. And your hygiene appointments are an hour? Yes, okay. So dentist, how long do you see the patients? Well, I do my exam about 10 minutes in and out. So you see your patients 20 minutes a year? Yes, okay. How can you personally have an amazing relationship with your patients? Now your patient, I'm not saying the patients don't love the dentist, but it's about everything else. It's about all of the feelings, how they feel when they're in the practice, what they see about you on social media. Do they even see you on social media? How they feel when they call your practice. Is somebody answering the phone or are they getting a voicemail? How do they get greeted when they walk into the practice? How do the assistants talk to them when they take them back in the chair? All of this matters because sometimes we're so focused, we forget the why. So we're so focused on production, overhead, getting the patients in, cancellations, all of this stuff that we've forgotten at the end of the day. These are people, and these people need to have an amazing experience. So I want to make sure that we now talk about patient experience and why it's so important, because the most important thing that we do at the front desk, some of you might say, oh, it's, confirmations, it's insurance, it's AR, it's all of that's important. But the most important thing that we do at the front desk is taking care of the patients. Right? Patient experience. And when we live in the dental box too much when it comes to the team, and this isn't just front office, honestly, this is assistants and hygienists. If we live in the dental box too much, we're too focused on work and insurance claims and filling the schedule and turning over rooms and sterilization and getting our notes in and, all of these other things, which is all part of our job. It's all important stuff, but not ignoring our patients to do it. We have to make sure that we're prioritizing our patients, because the biggest complaint patients will say about your practice is, and I'll talk to people all the time and say, tell me about your dentist. And they'll say, well, when I first started with them, I felt like a family member. I felt like I was part of the team. They knew who I was. Now I feel like a number. And that's really what happens. I mean, think about your morning huddles where we start going through today's schedule and it's like, who's coming in? What insurance do they have? How much do they have remaining? What tooth number are we doing? What procedure code are we doing? How about, did they just travel? Do they have a new grandbaby? Like something about the patient. We forget about that. We get into numbers, productions, number production. We can't forget about the patients, because I want you to know your patients could easily leave your practice and go to a dentist down the street, right? Your patients are being marketed to. I know in my house, I get 5 or 6 postcards from dentists all around the area. If I don't feel like I'm getting the attention and the experience that I deserve and need, it's very easy to find another dentist. And when we're talking about reactivating our patients, we want to make sure that we're just trying to get them back into dental care, not that they've left and gone somewhere else. So we need to realize the most important thing that we do in the practice. So I say that there's 3 types of customer service. There's awful, there's average, and there's amazing. Now, you guys are here today, so I'm going to guarantee you guys are not awful. You are at least average because you're here and you care. You're looking to grow your practice. You're looking to get more new patients. You're looking to get your patients back in. But if you're average, that's just not okay anymore. You need to be doing things to become amazing. You need to be doing things that give your patients that experience, because if you want the patients to accept their treatment, if you want them to go out and tell other patients about you, to do reviews, they're not going to do it when you're average. They're only going to do it when you're awful or amazing. And we don't want them out talking about us because we're awful. So we need to become amazing. And that's really the focus of this section today. But like I said, I understand I'm not a hotel concierge. Like a hotel concierge, what do? They take luggage. They go get, reservations for restaurants. I'm a dental office manager, and this is what our days look like. Do they not? Like you're sitting at the front desk and 6 lines ring and the phone, then doctor's walking in and patients are asking this and that, and hygienist wants to know where their patients are. So we have to balance this along with giving our patients amazing experience. So I want to tell a story, and this story actually just happened this week. I have a friend of mine, which I'll introduce to you guys over the course of the day today, who, since meeting me, I don't know if you guys have ever noticed this, my team will tell you, most of my team didn't start in dental. I'm a big fan of not hiring people with dental experience and teaching them the dental. Most of my team have never started with dental, but when they get to know me and they get to know Front Office Rocks, all of a sudden they start spending more time in dental offices, whether it's their kids need braces or now they got, they lost a tooth or something happened and now they're in dental offices all the time, right? So people get to know me and all of a sudden they have a lot of dental needs. So this friend of mine had a tooth that was cracked, an old filling, a tooth that was cracked that started causing him problems. And he was going to an office that wasn't amazing. So of course I referred him to an office that was amazing of a dentist that I'm friends with and said, you need to go to this dentist. Well, unfortunately, he's had a lot of old dental work now that's starting to fail. And number 3 had his tooth was sensitive. And so he sent him to the endodontist and he got a root canal on number 3. Well, while he was waiting to get the crown, another tooth was sensitive, so we waited 2 months and 1 day. 2 months and 1 day till he bit down on a nut on a root canal tooth with no crown. And what do you think happened? Cracked the tooth, right? So now 2 months and 1 day later, he goes back to the dentist, and the dentist says, we need to pull it, you need to go to the surgeon, and we're gonna need to do an implant, okay? So that root canal lasted 2 months and 1 day, which isn't the best, but so we go to this oral surgeon. Now I go with him to the oral surgeon, and I know this oral surgery office. I've never been there myself, but I go in, and can you imagine if I came to your office, like Laura from Front Office Rocks is in the office? They don't know who I am, but I'm analyzing everything. Now I understand we're in COVID time, we have to wear masks, everything's a little different, so I give him a grain of salt with this, but we go in. He shows up. I want you to listen to how this appointment goes and think about customer service, because there's a difference between efficiency and customer service. We show up, he walks to the front desk and they say, Mr. Martin? And he's like, no. Oh, what's your name? So they call him by the wrong name. Wrong patient, wrong name. They don't even say, hi, welcome. They call him by wrong name, wrong patient. Oh, sorry. Okay, great. So you did your paperwork online. Can I have your driver's license? That scan didn't come in very good. Okay, so gives him the driver's license, she scans it. Okay, have a seat. So we sit down and we sit there for, 7, 8 minutes, not an extremely long time. 2 people sitting at the front desk. Now we have to wear masks right now, I give you that, but we've been talking about this here. You know what schmizing is? Is it schmizing? Schmizing? Smiling? Smiling with your eyes? Like I can smile with your eyes, but you can also talk behind a mask. You can say, how's your day going, right? Nothing. Looks at us, we're sitting there, no conversation, nothing. They're not on the phones, 2 people just sitting there. Someone comes out, goes, we're ready for you. We go back, we sit down, doctor comes in, explains what's going on, says we're gonna do it now. Financial coordinator's gonna come in. He goes out, financial coordinator comes in, sits down, here's what it's gonna cost, here's the treatment plan, we can do it right now, do you wanna do it now? This is exactly what happened, and I'm watching and they're super efficient, right? He signs the treatment plan, she says, do you have any questions? He says no, out she goes. In comes 3 assistants with the oral surgeon, like he's about to have a heart attack. And they've got all of their trays, their stuff. They escort me there. She's like, ma'am, you have to leave now. Escort me out the room. I swear I thought he was having a heart attack, not a tooth pulled. I leave. I go sit in the car. 15 minutes later, he walks out with gauze in his goodie bag. 15 minutes later. Now, that office was efficient. That office was good. He's a great oral surgeon. I know this office, or I know this dentist, right? He got good care, but was that good customer service? Think about it. Was it good customer service? Like, not one person, think about the things where it's like, how are you doing today? I mean, first of all, this patient just paid for a root canal 2 months before. They're in pain. They're paying money to come in here. They're scared. All of the things, and not one person said, how's your day going? How are you today? How are you feeling? Was there anything we could do for you? Good job, right? Nobody said anything. They got him in and out in 15 minutes, okay? Of course, I sat there and thought, ooh, I have an article I need to write about this. I have something I need to teach on this because the office is super efficient. But he left kind of going, well, why wouldn't I just go back to the practice I used to go to that was a lot less expensive and just have the tooth pulled there, right? And I had to convince him, trust me, this doctor's worth it. And we believe the doctor's worth it, but he didn't feel it, and I didn't feel it, and I was there with him. So as we're going through this, and when you guys go into your smaller rooms, start thinking about, sometimes we're too efficient. Sometimes we're too focused on insurance and numbers and procedures and the schedule. And I'm not saying that's not important, but what I am saying is don't do it in lieu of customer service. It doesn't take but a couple minutes to add, how's your day going? How did you hear about us? We're so happy you're here. Something, right? Because our patients feel like we're treating them like a number. Our patients used to feel like we treat them like a patient. Good social media post right here, 10 points, right? Because we tend to get busy and get effective and get procedures and get policies, and we get all of these things going on that we forget at the end of the day that this is the person we're dealing with. So my number one rule for you is, if you're trying to decide if you should do something or not, I think you should always, and I teach my team this, always treat your patients like family. If you would do it for family, do it for the patient. Now, here's my disclaimer. For family members that you like, okay? So I'm not talking about the crazy aunt that you never see except for at the holidays and she drives you crazy. I'm talking about family members. If it's your mom or your grandma or your kids, if you would get up and help them get into the practice and open the door, if you would call the specialist and help them make an appointment, if you would spend a little extra time with them explaining to them their dental needs, if you would hold their hand because they're scared during a procedure, then do it for your patients. That's going to be that little bit of extra that you need. And we don't need to write a policy around this. We don't need to say, always hold patients' hands, always grab the door for them, always offer them an umbrella. Just do it like it would be for your family, a family member that you like.